Hey everyone, my friends out there. So this is a follow-up from the CT video I posted where I asked what is going on in my body. And the answer is, shout out to Dr. Sandeep Jakir and Mrs. Jacqueline. Y'all were pretty much correct. It's an arteriovenous malformation of my pelvis. Perirectal, of course. So we're going to run through this. Now don't cut this video off, y'all, because it's going to be about 5 minutes. It's going to be very interesting. It might run a little slow, but it's worth the wait. So this is under fluoroscopy, x-ray basically with contrast, 2-hour procedure, diagnostic and therapeutic, where they fix that. We'll show all that. Common iliac artery and the branches. I mean, not the branch, but you know, the aorta and the common iliac arteries, normal. And then, excuse my video skills if it's bad. Here's the normal left side, right? Internal, external iliacs and the branches. And here's the right side with the AVM. See the nidus of the AVM. AVM is just an abnormal connection between arteries and veins. It's a shunt of high flow and basically dilates the pelvic veins and could rupture potentially. So what happened is they get the AVM and give you, so Dr. Sandeep, is that how you say it? Sandeep, I believe this is, okay, internal iliac, and then you have 5 arteries feeding the AVM. You have 3 major trunks off of this, right there, there, and there. I don't know what those are. Here's probably the biggest one right here. Then you have the internal pudendal artery and the inferior gluteal artery feeding the AVM. So they have it in really good view right here. There is draining into 3 venous areas, I think both internal iliacs and 1 external iliac maybe? Or is it 1 external and 2 internal iliacs? Iliac vein drainage. That's why it's having left-sided pelvic pain as well as right, but mostly on the right. Now the fix, check this out, the fix. So this is the theory behind it. AVMs are dangerous to fix, especially in the pelvis. They're really rare anyways, but because there's so much going on down there where you run the risk of shutting down normal vasculature and causing necrosis, etc. So like here, see these major trunks. Now he said, I'm going to pick out, this is the interventional radiology here, I'm going to pick out one of these major trunks of the AVM and isolate it from normal vasculature, and that's where I'm going to inject the onyx. I use onyx 18 and a vascular coil, and the coil was used, I believe, initially to prevent embolism into the pulmonary vasculature. So there you see no normal blood flow like all this in here. So you can inject the onyx safely and not shut off normal blood flow. Here comes the onyx in. You can see this onyx. This is in here, so you can see that. But there's, he does it, this is 2 hours long. So I'm just gonna run straight to the end of this because y'all don't wanna watch 2-hour long video. So let's get all the way to, we're almost done here. MRA is coming when I get my disc working. My disc wouldn't work tonight. That's really interesting too, when you can see it in 3D. Better than the CT, of course, because it's just at the vessels, and I'd like y'all to see that. So here is, there we go. So you can see the onyx a little better. And then the last picture, I believe, was this one. And you can see there is only slight filling of the AVM right here, and on post-MRA scans, this is all gone now. So somehow it thrombosed or is not flowing anymore. And you can see all of the onyx, the casting of the onyx, and there is a coil, I believe, I'm not sure where it was. This might be the coil right here, right there. That might be where the coil was placed. For some reason I thought it was up higher. So you go from this to this. My oxygen saturation dropped to pretty low. But great doctor, amazing team there. So anyways, that's it. I will show the MRA hopefully. I do have a question. if you're still online, well, I'm not gonna ask you because you might not still be online watching this. This has gone on a little long, but anyways, my question I will post in the description. All right. Of course, that's my bladder. All right, we're out. Wait, we're not out. We're not out. Hold up. Stay on here, y'all. This is my pelvis now. I'm gonna ask a question. I've been feeling sick for a month and a half now, having night sweats, splinter hemorrhages, feel yuck. Don't know what's going on. My question is, this is the onyx here, which I showed you on here, right? Here it is on CT scan now. This is my pelvis. So you can see it's all there. My liver is perfectly normal here. Everything else was normal. But here it was with all the glue in there. Onyx and coil plugging up those malformations. Now my question is, hopefully you're still listening, y'all. Could there possibly be an infection of bacteria from whatever? I don't know how I would have got it, but maybe some of this glue went into the bowel and something attached to it where there's a infection inside of this in my body causing this havoc and splinter hemorrhages to appear on my fingernails and night sweats, etc. Constitutional symptoms. This has been going on for a month and a half. Also had some heart palpitations. They did an echo. It's normal. TTE, not TEE, but it was normal. Where's the glue? I want to show you this in the sagittal plane, how much glue this was. Onyx 18. We're getting to it. Here we go. It's coming in. So there it is. You can't even tell what's going on CAT scan anymore. MRI's fine. It doesn't have any artifact, but this CAT scan does have artifact. I don't need to show the axial, but if I can find one, I'll pull it up. Here's an axial. It's going to take way... Well, we're getting there. There's the liver. This is from 2000 and... this is a couple years ago, 2016 in June, right after the procedure was done. I've had recent scans since then with nothing showing up. So you can see. Now there's a possibility of like remaining AVM in this one here, right there. It looks like almost fluid level, but it's all thrombosed now since the procedure. Well, since like 4 months after the procedure, the MRA didn't show anymore. So we're done, y'all. Thanks for checking it out. MRA's coming in a few days, hopefully, if I can get a new disc. If I can't, they won't be coming.